Hi, everyone. My name is Jennifer Hagenberg. I'm currently a Southern New Hampshire graduate student in the MSN track for nursing education. I'll be receiving my master's degree at the end of this semester in November. And I'm currently completing my clinical hours with Dr. Ortiz at Suffolk Community College. And we were discussing that it seems to be that Select All That Apply is one of the more difficult things that the students are dealing with their examinations in nursing school. So I figured making a little workshop to give you guys strategies in order to be able to correctly answer these questions for the rest of your examinations for nursing school, and then of course the NCLEX. So they're using an increasing amount of Select All That Apply questions on the NCLEX, and they don't give any partial credit for it. So you have to choose every single correct response in it in order to get the answer correct. So if you pick 2 out of 4 of the correct answers, you still get the question wrong. On the NCLEX, Select All That Apply questions have to have a minimum of 2 choices for each. So if you have 5 choices in total for the question, at least 2 of them are going to be the correct answer. These are the trickiest questions for almost everyone. You're not alone. Everyone has the same issues with them. Everyone hates them. When I was in nursing school, I struggled with Select All That Apply questions. So you're in the same boat with everyone. So don't get too stressed about them. Hopefully these strategies will help you and be able to tackle them a little bit easier. And you're not alone. That's the most that I could say for you. So strategies for tackling Select All That Apply questions. We're going to go over a couple of them. The first one that I came up with is you want to treat all Select All That Apply questions as true or false questions. I'm sure your professors have told you this in the past, but it's the easiest way for you to be able to do these questions. I know it's a little out of the norm when you're answering multiple choice questions. You have to change the way that you think when you have these questions, but you want to read the question completely first, understand what the question is asking you, and then you want to read each answer choice and ask yourself, is this true or is this false? And you always want to relate the answer choice back to what the question is asking you. So even though the answer choice may be correct in nature, it might not be correct in response to what the question is asking you. Okay. So if the question is asking you a specific thing and the answer choice is correct, it doesn't mean that it's a correct statement for what the question is asking you. And we're going to go through some review questions to make that seem a little bit more easier, okay? The second strategy is you want to read each answer choice individually and answer it before you move on to the next one. So you want to compare the answer choices to one another with Select All That Apply questions. You want to treat each answer choice as their own without involving the other choice. So typically with multiple choice questions, all of them may be correct to a degree, but you want to pick the choice that is most correct. However, in Select All That Apply questions, you have that opportunity to have more than one correct answer. So if you start comparing the answer choices to each other to see which one is more correct, you're going to get irritated, you're going to get frustrated, and you're probably going to get the question wrong. Whereas if you just go through A, B, C, D, and E, if you read A, decide whether it's true or false, pick it. If it's true, circle it. That one's correct. Move on to B. Do that one again, all on its own. You want to compare these answer choices to each other because there's no reason to compare them. They each can be correct. They each can be false. One can be correct. One can be false. They're completely separate from each other. Number 3, you want to stay away from any answer choices which include the words always or never. Okay, so in the world of nursing, things are constantly changing. We're always doing evidence-based practice. We're always changing our practice, our protocols, our procedures, policies, everything. Answers which include these definitive words are typically going to be wrong because everything in nursing isn't always, and it's not always never. Okay, so anything that's any question that has some sort of definitive word in it, like always or never, is most likely going to be wrong because things typically in nursing aren't always going to happen or aren't ever never going to happen. Okay. The next strategy is you want to trust your gut and do not change your answer. I'm sure you guys have been told this a million and one times. I've been told it a million and one times by my professors. I still would have the tendency to change my answers because I would rethink it. Do not do it. I know it's hard not to, but do not do it. You want to go through each answer choice individually, move on from the answer choice after finishing it, and do not change your answer unless you're 100% sure you made a mistake on that question. Okay? 99.9% of the time, your gut is almost always right the first time when you pick that answer choice. When you go back to a question, you're going to overthink it, rethink it, bring in more information than's necessary, and overthink it and pick the wrong answer by changing it. Okay? When your brain sees a question and you immediately think you see the correct answer, it's most likely right because your brain is remembering information that you have stored. Okay? So don't let your mind play tricks on you. Answer the question, leave it, and move on. Never change your answer. And of course, practice, practice, practice. Okay? The more select all that apply questions that you do, the better off you are. Select all that apply questions aren't typical. You really only start seeing it when you're in nursing school. You don't see it in high school or other, if you have other degrees. It's a different format and style question. All right. You're only going to get comfortable with these alternative form questions the more that you do them. The biggest thing that you can do is just practice questions, practice questions, practice questions. When I was studying for my NCLEX, I barely did any content review. All I did was questions day in and day out because you have to learn how to answer these NCLEX questions. You're never going to be expected to know all of the information or retain all of the information because there's so much you learn at nursing school. But if you understand and figure out how to start answering these questions, you can get them correct even without knowing fully all of the information. Okay, so you just have to keep practicing and practicing. All right, so now we're going to do a couple practice questions. Okay, so a 6-year-old child with leukemia is hospitalized and is receiving combination chemotherapy. Laboratory results indicate that the child is neutropenic, and the nurse prepares to implement protective isolation procedures. Which interventions would the nurse initiate? Select all that apply. Okay, one of the other things that you want to do too is you want to pull out those key words within the questions because they're going to give you a lot of beef in those questions. Try and throw you off, give you all this information, think that it's all important. When in all reality, there's only like 2 things that's really important in that question. Okay, so out of those 3 sentences, the biggest things that you want to look at is the neutropenia, okay, and that the nurse is trying to implement protective isolation procedures. Okay, so isolation procedures and neutropenia, those are your 2 big words. All right, so now we're going to move on to the answers. So answer choice A, place a child on a low bacteria diet. Is this true or is this false? Okay, this is going to be true because we know patients who are neutropenic need to have low bacteria because you're trying to decrease the amount of bacteria that they're exposed to. All right, so we're going to pick A. We answered it. We're going to move on to the next one. B, encourage the consumption of fresh fruits and vegetables. Again, is this true or is this false? In this scenario, this is going to be false, okay? Because fresh fruit and vegetables have the ability to harbor bacteria on them, which will increase the patient's risk of getting an infection. All right, so that's false. C, perform meticulous hand washing before caring for the child. We know this is true, okay? You should be performing great hand hygiene with any patient that you're seeing. But again, you're trying to decrease the chance of this patient being exposed to any bacteria. So very meticulous hand washing is important. D, change dressings using sterile technique. This is also going to be true. Okay, again, you're trying to decrease any chance of this patient getting exposed to bacteria, which one of the isolation procedures could be to have all the dressing techniques meaning to be sterile. Okay. E, allow fresh cut flowers in the room as long as they are kept in a vase with fresh water. Is this true or false? This is going to be false. Okay. Flowers can have bacteria on them. They can have bugs. They can bring in things from the environment that we don't want in a neutropenic patient's room. All right. So this is going to be false. F, restrict all visitors. Okay. Now this one can be tricky, but this could be one of those questions. This is one of those answers where it's giving you one of those definitive words. So all, right? We're restricting all visitors. This is false. Okay. As much as the patient is neutropenic and you want to decrease any exposure that they're having to bacteria, it's also incredibly important for this patient to be exposed to their family, to have that human contact. You're going to restrict some visitors. Okay. You're not, if people have recently traveled, if any of their family members have been sick recently or exposed to someone who's sick, those visitors would be restricted, but you don't want to restrict all visitors because that human contact is incredibly important to this patient's recovery. All right, so F is going to be false. So the correct answers for this select all that applies scenario is A, place the child on a low bacteria diet, C, perform meticulous hand washing before caring for the child, and D, change dressings using sterile techniques. Okay, on to the next practice question. So, a client with a recent cerebrovascular accident, or CVA, is on a dysphagia diet. What does the nurse do to ensure client safety while eating? So important in here is dysphagia and eating safety. Okay, those are your key words that we're pulling out from there. Answer choice A, monitor the client while eating. True or false? This is true because we already know the patient's on a restrictive diet, okay, and we want to increase their safety while they're eating. So we want to monitor the client to make sure that their swallowing is okay and that they're not aspirating any of the food. B, feed the client. True or false? This would be false, okay? As much as the patient has suffered from a recent CVA, they're on a dysphagic diet, this doesn't mean that the patient is unable to feed themselves. You still want them to be able to do their activities of daily living. You don't want to, the nurse should not be doing everything for the patient, okay? They need rehab, they need to be able to move, they need to get used to eating for themselves. So the patient is able to feed themselves, which we're not sure if they can or not because it's not listed in the question. We're not going to say that the nurse should feed the patient. C, place the patient in a seated upright position. This is true, okay? Anytime any patient is eating, they should be in an upright position to decrease their chance of choking or aspirating their food, all right? So this is true. D, check for pocketing of food. True or false? This is true. Okay, so a patient who's on a dysphagia diet, you already know that they might have some difficulty swallowing. You want to make sure that this food isn't staying inside of their mouth and having the potential to slide down their throat and go into their lungs and cause an aspiration, okay? So that's true. E, offer thinned liquids. True or false? This one is false. Patients on a dysphagia diet, we know that they need thickened liquids. They can't drink thinned liquids, because that could go down their trachea into their lungs and cause an infection. Okay, so out of all these choices, A, monitor their client while eating. C, place the patient in a seated upright position. And D, check for pocketing of food are correct. Okay. Another practice question. This one is 3. The nurse who works on a postpartum floor is mentoring a new graduate. She informs the new nurse that a postpartum assessment of the mother includes which assessments? Select all that apply. So these key answers in this is mother assessment and postpartum. Okay, so postpartum assessment and the mother. So now when we go down to the answer choices, we're going to go one by one and do true or false. So A, vital signs of the mother. True or false? This is true because the question is asking specifically about the mother's postpartum assessment. Of course, we want to check her vital signs to see how she's doing. Okay, we want to know what the blood pressure is, what her heart rate is, what her pulse ox is. B, newborn's vital signs. True or false? Well, we know that checking and assessing the newborn's vitals is also important, but what is the question actually asking us? It's asking us about the postpartum mother assessment. So this would be false. As much as assessing the newborn's vitals is important, okay, and the nurse would eventually do that, that is not what the question is asking you, okay? C, pain level. True or false? This is true. We should always be assessing our patient's pain level to see where they are, see if it's adequate, see if we need to give them pain medication. Okay, so this, of course, would be part of the mother's postpartum assessment. So C is true. D, head-to-toe assessment. True or false? This is also true. Anytime you're doing a postpartum assessment on the mother, you want to do a head-to-toe assessment. Okay, you want to make sure that everything's okay. You want to look at all of your body systems and check everything, okay? So you're aware of the situation completely and you know your patient. E, head-to-toe assessment of the newborn. So this one would be false because the question is asking specifically about the mother's postpartum assessment. So again, of course, doing a head-to-toe assessment of the newborn is important and it's crucial, but that's not what the question's asking you, okay? So always remember, you always want to take a deep breath when you're answering these questions, okay? It's important for you to take a deep breath, wait a couple seconds, regain your composure, okay, and then answer the question. You want to read the question slowly and fully to point out those key words that's in the question, so that you know exactly what it's answering, exactly what it's asking you for. And you want to take each question and answer choice one at a time. Okay. Try not to rush. Try not to compare your answer choices to each other, and just read the question fully, pull out those keywords, and then work from there. Okay. These questions are very scary. They get everyone anxious. We have a tendency to rush through them. All students do. You want to try your best to stay as calm as you possibly can. I know these are weird questions. You're not used to answering them. The biggest thing is just keep practicing, practicing, practicing. Okay. You're going to get through it. You're not alone. Everyone feels the same way. Okay. I hope this video is able to help you, and you can use this as a resource to help you with the rest of your exams during nursing school, and then to also hopefully help you pass the NCLEX. Okay. Thanks.